This patient was referred to me for endodontic treatment of tooth number 30. According to the patient, the restoration here is about 2 years old. A few days ago, tooth started to hurt a lot. She says she couldn't even touch the tooth. Then she noticed she called it a bubble swelling under the tooth, and she went and saw her dentist, and her dentist put her on antibiotics and referred her to us. So when I examined the tooth was very tender to percussion and palpation. I did notice a small buccal area of swelling just inferior to tooth number 30. Probings were 2 to 3 millimeters all around, and as you can see, radiograph shows, look at that pulp stone right there in the pulp chamber. All right, periapical lucency, as you can see here. All right, so we discussed options with the patient. Patient wanted to try to save the tooth, and that's what we did. So let's go ahead and take a look at the POV clinical video of this tooth on how I went ahead and did this root canal for this patient. So local anesthetic is going in. Inferior alveolar nerve block. I start with lidocaine. I apologize, lidocaine. And then I'm going to go ahead and give a marcaine also, both with epinephrine, of course. So I'm going to fast forward all of this. All right, so let's go ahead and put the rubber dam on. Clamp. Rubber dam. How long is this taking? 20 seconds to put the rubber dam on. 20 seconds. Done. Remember, no rubber dam, no root canal. That's it. Now my assistant is gonna wipe the tooth down with isopropyl alcohol. And let's go ahead and get started on this tooth. Endo access. I use a end cutting cylindrical diamond burr. I don't use water. Please, you use water. Even though I'm going to be doing a root canal and I don't care about the status of the pulp, but if you don't know what you're doing with your burr, you can fry the periodontal ligament. I don't use water because I need to see. I want to be able to see. And I know how I use my burr. So I don't fry, smoke the PDL. But please, for you beginners, I'm begging you, in this situation, don't do as I do. Use water. I'm just brushing. I don't leave the burr on the tooth. Brush a little bit at a time, as you can see. A little bit of brushing here, a little bit of brushing there. Brushing away the dentin. So I moved the rubber dam a little bit more mesially, as you can see, because I want to be able to see the outline, the external outline of the tooth. So I know my endo axis is nice and straight. Sometimes we do that. And here, patient also complained of some pain that she was experiencing. So I'm gonna be administering some PDL injections. This is a PDL pen. I don't know what the girls gave me. I think it's Septo. And I'm gonna just deposit a few drops. And that should basically do it. All right. So here we are so far. My assistant is applying pressure to the area where I administered the PDL injection. All right, here we go. This was actually a partially necrotic tooth. That's why she was feeling it. And that's why you see some bleeding from the pulp tissue. Just brushing the pulp chamber walls, trying to get the straight line axis and smooth walls. So here what we have so far. Remember, we had that huge pulp stone at the center of the pulp chamber. So I'm right on top of it right now. Here we go. My number 20 stainless steel flare file in my reciprocating handpiece, running at 1000 RPM, torque off. Let's flare the coronal 1/3 of these canals. The mesials are pretty tight, as you can see. So that's what we have so far. But I'm going to clean it up. Still needs some cleaning up. I'm just trying to get a feel. My assistant is, again, wiping the tooth down with isopropyl alcohol. Here I go in with my ultrasonic unit, the Ultramin Pro by 8 teeth, and take a look. Right there, that's the pulp stone. It's going to pop right out. There you go. There you go. It popped right out. Did you see it? Yep. There he goes. There he goes. All right. Very good. There you go. You can see the partially necrotic pulp tissue right there. I'm just trying to get straight line access into the canals. Very good. All right, let's go ahead and irrigate with 6% hypo. Copious amounts of 6% hypo is going to be used, as you can see. You know that saying, the solution to pollution is dilution. All right, let's go ahead and put a 10C file, that's a 10C file, in my reciprocating handpiece. Let's go ahead and get a feel for these canals. Just get a feel for them. Running the reciprocating handpiece at 1000 RPM, torque off. I'm not only instrumenting the canals, I'm also activating the hyposonically. And look at how I'm using the number 10C file. Up and down and a brushing motion, brushing out. You see that? Brushing out to remove the debris. All right, let's go to the next. That would be the mesiolingual canal. And again, you can see I'm using it in a brushing motion up and down. Let's go ahead to the distals. Up and down, brushing motion. I'm not forcing the number 10 C file into the canal. I'm just trying to get a feel for the anatomy of these canals, for the curvature and anatomy of the canals. All right, let's take a look. All right, let's see if we can get a working length. I'm using the Finepex apex locator by 8 teeth here. Let's see if we can get a working length. You see the pulp chamber is empty of hypo, but there is some hypo in the canals. You need some kind of a conductive liquid, and hypo is conductive. But the pulp chamber is void of hypo. All right, so we got the mesial buccal length. I'm trying to see if I can get the distal buccal length. Just pay attention. I'm also, as you can see, I'm kind of instrumenting with this number 10 file that's attached to my apex locator. I'm also instrumenting with it. You can see watch winding. I'm watch winding, up and down, watch winding. I'm using my Endo Explorer here to see if there's perhaps maybe a small pulp stone. Trying to see if perhaps maybe there's another mesial canal. All right, I'm gonna try to explore that area with my ultrasonic. I switched to a different ultrasonic tip, as you can see. It's a thinner tip. I don't know the name of it. Don't ask me the name. Just pay attention to how it looks, and then you can go to the ultrasonic tips catalog, and then you can find it probably. Don't ask me what the name of that tip is. Yet, I don't think that was anything, but it was worth exploring, because you really don't want to miss a canal. That's the advantage of having a surgical operating microscope. You pay attention to everything. You don't miss anything. All right. Now that I have the working lengths, and it looks like the working lengths are 22 millimeters, I'm going with my number 10C file measured to 22 millimeters in my reciprocating handpiece that is running at 1000 RPM with the torque off. Up and down brushing motion, as you can see, up and down brushing motion. I'm not only instrumenting and shaping the canal, I'm also activating the 6% hypo. Sonically, sonic activation. All right, that's the mesiolingual right now. And you will see at the end, this tooth had a very interesting anatomy. And the canals were pretty curvy, actually. You'll see in the final PA. But right now, I'm just going with my number 10C file, taking my time, instrumenting to working length, up and down, brushing motion, as you can see. Activating the 6% hypo at the same time as I'm instrumenting and shaping and flaring the canals. Very good. Look at that. Not only instrumenting and shaping, but also activating sonically the 6% hypo. Let's go to the distals. And I mean distals, you'll see in the final PA. Just activating the 6% hypo and instrumenting and shaping the canals up and down brushing motion with my number 10C file in my reciprocating M4 reciprocating handpiece that I'm running at 1000 RPM with the torque off. All right. I'm gonna try to get the working length of the distal canals. I do this multiple times. I confirm and reconfirm. You know that saying, measure twice, cut once. Measure twice, cut once. All right. I'm using my microsuction to inspect the canals and see what I'm dealing with here. Because I noticed some interesting anatomy. And again, you'll see in the final PA. Watch winding, watch winding, watch winding, and reaching my working length and confirming it. Again, this is the fine pex apex locator by A-Teeth that I'm using. I'm feeling multiple canals, mesials and distals. I can just feel it in between my fingers via the file. Very good. All right. So I'll have my assistant read it and tell me what the working lengths are. All right, very good. Now that I have my working lengths, I confirmed and reconfirmed. Back in with my number 10C file. Looks like 23 millimeters here. Up and down, brushing motion, activating the 6% hypo at the same time as I'm instrumenting and shaping the canals. And pay attention how I'm using this handpiece and the file. Up and down, brushing motion, instrumenting and shaping the canals to working length, and also sonically activating the hypo, the 6% hypo. Please practice on extracted teeth. You can't just buy one of these and start practicing on your patients. Patients don't pay you to practice on them. And look, I'm back in again with my apex locator. I should say, the saying goes, measure twice, cut once. I have a new saying, measure 10 times, cut once. I'm that OCD. All right, let's go ahead and irrigate with 6% hypo. Copious amounts of 6% hypo, as you can see, throughout the procedure. Just constant irrigation with 6% hypo. I mean, look at the amount of hypo that I'm using. All right, number 12C file, 23 millimeters. Working length now, as you can see. Up and down, brushing motion. Brush away from the danger zone, which is furcation here. Up and down, Not only instrumenting and shaping the canals, but also activating the 6% hypo. And you saw with my finger, I had to just pre-flare this number 12 C file a little bit. Up and down, brushing motion. I'm not forcing the file. I'm just allowing it to go where it wants to go, follow the path of the canal. Up and down. There you go. Brush. Away from the danger zone. I can feel the canal curvature. Let's go to the distals. Do the same thing. Up and down, brushing motion. Until we reach our working length. Activate that 6% hyposonically at the same time as instrumenting and shaping the canals. Very patiently. I'm not forcing anything. I'm not rushing. Every time I move the file out and back in, I feel like I'm inside of a different canal. And you will see. Wait for the final PA. You'll see what I'm talking about. Up and down, brushing motion to my working length. Activating the 6% hyposonically at the same time as instrumenting and shaping the canals. M4 safety handpiece, reciprocating handpiece is running at 1000 RPM with the torque off. Look at the curvature of these canals. Look at the apical curvature of these canals. The file comes out with, it's already has an apical curvature to it because it followed the apical anatomy of the canals. Look at that. All right, let's go ahead and irrigate again. 6% hypo. Get that hypo in there in the canals. Excellent. The pulp chamber is full of hypo, 6% hypo. Let's go to 15 C file. Again, up and down, brushing motion to 23 millimeters, up and down, instrument and shape the canal and sonically activate the hypo at the same time. I'm in the mesiolingual right now. Up and down, brush away from the danger zone. Distal canals now. I'm in the distal buccal. Up and down, brushing motion. Away from the furcation. Up and down, activate the 6% hyposonically. There you go. Very nice. Excellent. Just letting the file do its thing. Up and down, brush, brush, brush. Activate the 6% hyposonically at the same time. $23 millimeters. I'm in the distal lingual. Now I'm in the distal buccal. Brush, brush, brush. Up and down. Instrument and shape. Activate sonically the 6% hypo. You see that? All right. Let's go ahead and irrigate again. Get rid of all the dentine debris and remnants of the pulp tissue. All right. Let's go in with our flare file again. I'm in the mesial buccal right now. Up and down, brush, brush, brush. And that's a number 20 flare file. And this is a 20, right now I'm using a 21 millimeter file. Flare file, okay? Just using this file to flare, the name implies, flare the coronal to mid and slightly apical of the canals. Just flare them. As you can see, I haven't used a single NiTi file so far. Just stainless steel K files, C files, and my number 20 flare file. As you can see, the working lengths are 23 millimeters, and I'm already going with my flare file. I'm going to 20, as you can see. So I got a good flare, and I'm also, of course, sonically activating the hypo. Flare file has a 5% taper. And remember, I'm brushing with all these files. When you brush with the files, you can determine, you can decide how much flare you want to give these canals. Irrigate again, 6% hypo. All right, number 12 now, C file. Going to working length. 23 millimeters, as you can see. In my M4 reciprocating handpiece that I'm running at 1000 RPM with torque off. Look at the curvature of these canals. The file just comes out already curved. I was just in the middle mesial canal. There you go. That's the middle mesial that I fell into. All right, so that's the distal buccal. And then you'll see middle distal and distal lingual. Very interesting tooth. Very interesting tooth. 6 canals. This still has 6 canals. You will see in the final PA. Instrument and shape, and also sonically activate the 6% hypo. That's my 12 C file that I'm using right now in my reciprocating handpiece that I'm running at 1000 RPM with torque off. I don't know how many times I say this, 1000 RPM, torque off, and then someone comments, hey Doc, what's the RPM of the handpiece, and what's the torque? I swear, it cracks me up. All right, 6% hypo, copious irrigation with 6% hypo throughout the procedure. All right, here I go in with my first rotary NiTi file. Woohoo! 223 millimeters. And it looks like I'm using these files, the Easy Shaper files. You can go to flexivodental.com and purchase them. Easy Shaper. I'm in the middle mesial right now. Just pay attention to how I use this file. Up and down, minimal apical pressure, minimal. And remember, I already created a glide path with my stainless steel files. And I already flared the canals. So I'm just not going in with straight up with from the beginning with my NiTi files, you know? You need a straight line access into the canals. You need a good glide path to working length. And then you start using your NiTi files. Again, copious irrigation with 6% hypo. Pulp chamber and canals are full of hypo right now. All right, I'm pretty much done. Remember, I don't have to use every single NiTi file in the package, in the kit. Why? Because I've been brushing with every single file. I've been brushing with every single file. When you brush with every single file with 08, 10, 12, 15, flare file, you already created at least 5 or 6% or maybe more taper. So when I use the first or second NiTi file, I'm brushing with it too, but I basically use these NiTi files just to blend in the shape, just to make the shape more smooth from the coronal all the way to the apical terminus of the canal. All right? I've already instrumented and shaped the canals because, again, I'm brushing with every single file. All right, so I'm going to the next. Easy shaper. Next one. And again, I'm not forcing it. I'm just letting it go to where it wants to go. There you go. You can see that. These canals had very nice curvatures. The last thing I want to do is break a file. So there you go. Let's go to the distals. Very nice, 23 millimeters. Not forcing it, not letting the file bind. There you go, 23 millimeters. And I'm in the middle distal. There he goes, middle distal canal. This tooth had 6 canals. There you go, 23 millimeters. Let's go ahead and irrigate again with 6% hypo. You can see how much hypo I use. Remember the saying, solution to pollution is dilution. Look at my endo axis. Can't get any more conservative than this. You see that endo axis? Practice on extracted teeth. I've practiced on thousands of extracted teeth. So, all right, let's go on cone fit. The pulp chamber and canals are full of hypo. And again, even with the cone fit, I activate the hypo up and down with the gutta percha cone. Mesiolingual, up and down, activate the hypo and measure. You can see the curvature of these canals as the gutta percha cone comes out. These are number 20. Gutta percha cones. Oh, you saw the little bend. So I went to another one. This is 5%, 4%, 5% gutta percha cones. Standard number 20. So these days, because we activate the hypo, we really don't need to taper the canals much and enlarge the apical diameter by much. This stage is just basically cone fit, trying to customize master gutta percha cones. All right. I let it sit, push it as far as it wants to go, and then measure it. If it's more than 23 millimeters, by whatever amount, I cut that amount. So I end up with 23 millimeters. This is how I make my custom gutta percha cones. Pretty straightforward. All right, we got our master gutta percha cones now. Let's go ahead and irrigate. Final rinse with 70% isopropyl alcohol. Microsuction. You can see the 3 distils, right? 1, 2, 3. One, two, three. All right. Sterile paper points. Dry the canals. These are sterile paper points. They already come packaged sterile. I buy them sterile. All right. Now I dipped the sterile paper point in some sealer, AH plus sealer, and I'm going to coat the canal walls with it. You don't have to do this. You can just dip your master gutta percha cone in sealer. But this is my technique. This is the way I do it. I like to do it this way most of the times. Not all the time, but most of the times. And I do it this way. You don't have to do it. Again, you watch these videos, my videos, to get some ideas. And then you practice on extracted teeth and you figure out what works for you. All right? This is how things work for me. You don't have to do exactly as I do. As long as you adhere to the fundamentals of endodontics, you can have your own way. You can figure out what works for you best. This is how things work for me best. All right, so, dip the gutta percha, master gutta percha cone in sealer, AH plus sealer, and then seat it to working length. Very nice. That was mesial buccal. Mesiolingual. And you asked me, Doc, where was the middle mesial? The middle mesial was inside of the mesiolingual canal in orifice. So the middle mesial and the mesiolingual shared the same orifice. So I'm going to obturate the middle mesial canal through the mesiolingual canal orifice. Look at that. Ha ha. You see that? Very carefully seating these master gutta percha cones to working length. All right. System B, to remove the coronal part of the gutta percha cones, master gutta percha cones, and thermoplasticize the rest. Number 2, Buchanan plugger. Apical pressure. Hold it for a few seconds. I remember this patient now. Very anxious. I remember she was extremely anxious. All right, let's go ahead and obturate the distals. I'm going to start with the distolingual canal. That was the more, kind of a little bit more straight than the other canals, I believe. Here we go. All right. Here we go. 3 distal canals. I'm going to use system B to remove the coronal portion of these gutta percha cones and thermoplasticize the remaining, and then Buchanan plugger to condense. And then I use my Obtura gun, Obtura 3 Max gun, to top off the gutta percha. I need to keep this video under 1 hour. So it's already 55 minutes. So you guys know the rest. So as I said, I'm gonna condense and then use my Obtura 3 Max gun and fill top of the canals with more thermoplasticized gutta percha, use my condenser to condense, and I'm done basically. And what I'm going to do is I'm going to clean the pulp chamber with 70% isopropyl alcohol and sterile sponge in the pulp chamber, followed by cavet, and we are done. Here you go. Here goes the Obtura gun. I'm going to stop here now and let's go take a look at the final PA so that we can keep this video to 1 hour. YouTube doesn't like it when it's more than 1 hour. Remember, this is what we started with. You think 2 canals, 2 mesials, and maybe 1 or 2 distal canals, right? Take a look. 1, 2, 3. Look at all that anastomosis. This is the mesials, and 1, 2, 3 distal canals. Look at our nice straight line access into the canals. This is another angulation. And again, you can see the middle mesial off of the mesiolingual canal system that we're able to instrument and shape and obturate 3-dimensionally. So 3 mesials, you can see, 3 distals. Again, you can see the 3 distal canals and the 3 mesial canals. And in this angulation, you can see the 3 mesial canals much better. 1, 2, 3. You can't see the distals all overlapping, but you can clearly see 1, 2, 3 mesial canals. And again, here you can see the 3 distal canals now. So anyways, this is how it's done. This is how I do it. As you can see, everything went beautifully. Everything went great. We temporized the tooth and referred the patient back to her dentist for the permanent restoration. If you like these videos, please make sure you subscribe to the channel. Make sure you press that like button. Click on that like button. Make sure you make a comment. And make sure you tell your friends about our channel. And I don't know how many more of these POV clinical videos I'll be doing, because I think I've covered everything. I've done upper molars, lower molars, retreatments, anterior teeth. I've done premolars. I've covered it all. I've covered everything. So I don't know how many more you guys want me to post videos, how many videos you want me to make, but it really depends on your reception. If I get a good reception, if I get good comments and likes and subscriptions, then it motivates me to make more videos. Otherwise, I think that is probably it. As I said, unless I get good feedback and likes, shares, subscriptions, comments, things like that, that will motivate me to make more videos like this. But otherwise, as you know, I don't make a dime. I don't make any money. I'm just spending so much time making these videos and editing them. Anyways, excellent. See you guys maybe in the next video, maybe not. But I will continue to post. Bye.